A D.C. father was told he didn't have long to live after he was diagnosed with advanced lung cancer. He was in a position where he could barely breathe, but now he's the picture of health and cancer-free, all thanks to a groundbreaking surgery. The research was just published in the top medical journal and could one day change the way we treat cancer patients. David Peterson was told he only had a year to live. The diagnosis? Stage 4 lung cancer.
I had a cough that wouldn't go away, and it was concerning. They did an x-ray and they saw a spot on my left lung.
That spot was a softball-sized tumor that had been growing on his lung for more than a decade. Peterson had surgery and started treatment, and things looked promising, but a year later, his cancer returned and it was more aggressive.
That put me in a round of chemo and immunotherapy, but it wasn't working. My cancer kept on growing and growing.
That's when he heard about the DREAM program at Northwestern Medicine in Chicago, with doctors trying a bold new approach to treat patients with lung cancer.
David was just like all of our patients. They were pretty much on deathbed. They've been told, go to hospice. They cannot breathe.
Dr. Anik Borat is the surgeon behind this procedure that's a first of its kind. Instead of treating the cancer in David's lungs, doctors remove both of his lungs and replace them with healthy donor lungs.
Unlike the conventional way, where you take one lung out, put a new lung in, then take the second lung out, put a second lung in. What we said was we're going to take both the lungs out and wash the chest cavity, the central airways, to make sure there's nothing left, and then put new lungs in.
And the results of the study, published in the Journal of the American Medical Association, even surprised doctors. Of the 98 patients enrolled, 17 underwent a double lung transplant. The other 81 were treated with medical therapy alone. 1 year later, every transplant patient was still alive. Among those who did not receive a transplant, fewer than half survived.
We had no doubt it's going to work, but we were astonished to see how well it worked. All patients had pretty dramatic improvement in their survival. Many of these patients are living cancer-free now.
Now 60 years old, David has no signs of cancer in his body, and he's embracing life again, reconnecting with his work as a freelance photographer and spending time with his family.
Went to my daughter's college graduation, which I wouldn't have been available for if I didn't have this transplant. It has been obviously a second chance at life, and it's incredible.
According to the American Cancer Society, lung cancer is the leading cause of cancer death in the U.S. It claims more lives than colon, breast, and prostate cancers combined. And it's not just smokers. In fact, David's disease was driven by a gene mutation. He hopes sharing his story will give other patients facing advanced lung cancer another reason to keep fighting.
Cancer is not something you want to sort of hang out and take your time figuring out what you want to do. You have obviously fears, anxieties, and things like that, but you really have to push those aside and lean in and just do everything you can.
Indeed you do. By the way, Northwestern is still accepting patients for the DREAM program. In order to take part, David had to move to Chicago for a year. He's now back home on Capitol Hill and goes to a local hospital for his screenings. And again, there is no evidence of cancer. He also said he is thankful to the organ donor's family and hopes to one day meet them in person.